Wes, is it true that after spine surgery I'm going to be bed confined for 7 days? No, absolutely not. Hi, my name is Wes Benson. I'm a physical therapist with Tier 1 Physical Therapy. At Tier 1 Physical Therapy, we have 2 locations, one on the west side on Mesa Suite, and then the one that I work at is on the east side at the corner of Hawkins and Viscount. One of the things that I think is very near and dear to my heart, both personally and professionally, is the idea of what is termed prehabilitation. So take rehabilitation and put a P at the very beginning of it, and now you have prehabilitation. Rehabilitation is the application of a therapy plan of care after a procedure. So rehabilitation after a total knee replacement versus the prehab idea is that therapy and those therapeutic principles applied before the surgery. I said that the idea of prehab is something that's important to me professionally and personally. In 2008, I had a bad car wreck where I ended up rolling my car over. I hit the wall at a really funny angle, and I ended up having a fracture at C5 and C6, which the fractures weren't a big deal. What became a big deal was the way that the bone healed. I grew these big bone spurs. We call them osteophytes. The spurs started pressing on my spinal cord. So I ended up myself having to undergo spine surgery. And so it was kind of almost surreal that I found myself in what I was used to preaching from a professional standpoint, now having to apply the same philosophy and the same lectures to myself. And what I was able to put off my surgery for almost 2 years by doing prehab. I tried to get myself back in shape. I started working out. I started trying to run a little bit. I was able to do a lot of specific exercises to help get my mobility and my range of motion back, even though it hurt, but I was able to get myself strong so that when I had my surgery, the surgical tolerance was excellent, and then the rehabilitation was a lot easier than I think it would have been had I not done the prehab efforts. In the economy of healthcare as it is today, where we have insurances limiting the number of visits that a therapist is able to work with a patient on, and then with Medicare, there's the Medicare cap, and the question is on the prehab side, how long do we want to do it? I typically try to limit my visits on the prehab side, make it more educational, a really good home exercise program, and having a really strong understanding, the patients and the family having a strong understanding that there is absolute ownership in this. It's not up to me, it's not up to me as a physical therapist to cure you, to make this surgery simple. There's a lot that you as the patient has to do. It's not up to the surgeon. I play an important role, the surgeon plays an important role, but the most important role is played by the patient. So on the prehab side, what I want to do is bring them in, show them the exercises and show them the plan of care that would probably be the best for them and get them as strong as possible, but then it's up to them to be doing all of this on their own. Now the rehab side, that's when we tend to see a little bit more on the visit side, a little bit more on the time frames by how long we go in therapy. Short on the prehab side, a little bit bigger on the rehab side. I have a lady who comes into the clinic right now. She had a total knee replacement and she's having a hard time. She didn't get prehab, and consequently her knee, you can't get it completely straight. If you can't get your knee completely straight, you're gonna limp. I mean, it's mechanically, you can't not limp if you can't get your legs straight. I have to work a ton trying to get this poor lady's legs straight. Well, she needs the right one done too, but she's saying already, no, I can't do it. I'm not gonna do it, I can't do it. Well, you can do it, just take ownership and put in the work that you have to do to not only rehabilitate your left leg, but let's prehabilitate your right leg, and it will be easier, I promise you. So I think because of my own personal experiences being a spine patient, a fusion patient, I've been able to establish a good rapport with some of the local surgeons. And where it works out for me professionally is that I am able to, with those spine patients, kind of help dispel some of the old cultures and myths that, oh my God, spine surgery, avoid it at all costs, you're going to end up being paralyzed, and the surgical techniques over the past, I don't know, 10, 15 years are exponentially better than they used to be. But still, people still have that idea in their mind that it's something that they should avoid. And I disagree. I think that it becomes my job to help the surgeons put those patients at ease. So this is where the prehab idea comes in. A patient will get referred to me with cervical pain or with lumbar pain, and we will do all of the traditional therapies that are necessary. Duncan McDonald, he did a really nice presentation for this series where he talked about the McKenzie method, and the McKenzie method is extremely applicable to a lot of spine cases. There's a few that it's not, and that's where the term that we use, where we practice physical therapy and we practice medicine. We all make mistakes, and so we have to, as we evolve in our careers, we try and figure out what works best for each patient, and there's not necessarily one specific formula that works for everybody. So we kind of have to figure out, with a very large, if you will, toolbox of different things, figure out what's going to work best for the patient. But if we're working with a patient and we're 3, 4, 5 visits in and we're not getting any results, and the patient ends up going back to the doctor, and the spine surgeon then starts having these conversations with the patient about, we're possibly looking at surgery, then I can at that point help ease some of those fears, talk to the patient. I have lots of time to spend with my patients. A surgeon, they have so many patients in the clinic and they're under such time demands that they don't often get the amount of time to speak to those things that I can. So I think I can supplement some of those conversations that the surgeon is having in a little bit more detail. And then, having been a survivor, then I can do it from a sympathetic standpoint as well, So the idea in the prehab then becomes, okay, we're going to shift our mindset, we're going to shift gears towards trying to, quote unquote, fix the problem so you don't have to have surgery, to, okay, now we know that surgery is inevitable. What can we do to get you as prepared as possible so that you tolerate the surgery? And that's where prehab comes into play. Reestablishing as much range of motion as we can get in the spine, reestablishing as much core strength as we can get, as well as overall just physical fitness and endurance. Talking with the patients and talking with their families and letting them know exactly what to expect and what not to expect. So you would be amazed at some of the questions and some of the statements that I hear people talk about when they talk about spine surgery, that they're going to be a good example. Wes, is it true that after spine surgery I'm going to be bed confined for 7 days? No, absolutely not. You're going to be up with the physical therapist that same day, walking down the hall, and they're just amazed. Am I going to have to stay in the hospital for a week and then go to rehab? Rehab, maybe, if you're having a real hard time, but most people up walking around the same day and home in 1 or 2 days. Dr. Smith patients typically go home the very next day. I mean, it's a 23-hour admission, and people are just absolutely blown away by that thought, because they remember their next door neighbor 10 years ago that had a horrible outcome, that ended up being in the hospital for 2 weeks and then having to go to rehab. And again, the surgical techniques, the skilled hands of the surgeon, everything is just so much better than it was before.